Welcome to this segment of Health Use. This month we're going to be doing a new format, and we're going to actually be visiting our emergency room and learning the ins and outs of how to use the emergency room. We often have patients kind of think, when is the appropriate time to visit that emergency room? And today we're going to learn all about what takes place in that emergency department. Welcome to Health Use. I'm going to be entering our emergency room through the walk-in doors. We also have a drive-in garage where our emergency vehicles often come to. Many of our patients can also drive into that emergency room if it's inclement weather, or they feel that the need is so urgent that they need to drive through the garage. Let's follow me into our emergency department. Our first guest is the nurse director, is Kathy Helmbrecht, the nurse director of our emergency department. Kathy's going to walk us through a brief intro on how the emergency room department functions.
Thanks, Colleen. Welcome. Welcome to Grand Itasca. As Colleen did share with you, my name is Kathy Helmbrecht, and I am the nurse director of the ER and the ICU and respiratory therapy at Grand Itasca. We want to share a little bit about the flow of the ER here with you first. So I want to share with you, we see about anywhere between 20 to 50 patients a day in our ER, and it can be an extension all the way up to 70, 80 patients a day. So we're ready to able to handle all of those situations. On that note, I want to share with you what you can kind of expect when you come into our ER. You'll initially come into our ER entrance where you came with Colleen. You'll be greeted by our receptionist here, and basically you'll be going into it and to seeing our nurse in the triage area. So with that, I want to share with you and welcome you to Grand Itasca in our emergency room here, and kind of learn as we walk you through the whole process.
Thanks, Kathy. And our next guest will be Michelle Peterson, our registration and admitting clerk here at Grand Itasca. I'd like to introduce you to Michelle Peterson. Michelle is one of our admissions clerks here at the emergency department. There are several. Michelle's going to tell you a little bit about what her job function is. Welcome, Michelle.
Hi.
Well, it's wonderful to have you on our program today. Can you tell me a little bit about your role here at Grand Itasca's emergency department?
So my role here is to greet the patients. I ask them why they're here. If they're here for the emergency room, I take their name and their date of birth, and I send them in to see the nurse right away.
Great.
When they come back out, that's when I do the admission process.
Okay. And what does the admission process entail?
The admission process entails taking all their patient information, such as address and phone number, making sure to get the proper insurance and emergency contacts. Emergency contacts are important because if a patient ever came in unconscious, we would like to have some family members or personal friends that we can contact for their behalf.
What if I don't walk in as a patient? How do they get that information? They come in through an emergency transport.
We come to the room, we do it at bedside.
Okay, great. So how long have you actually worked in the admissions department?
Admissions department, I've been here for 8 years.
8 years, so you kind of know what's going on. If you had a word of advice to give patients as they're thinking about coming to the ER, what would you tell them?
I guess to be prepared, to make sure that they have their insurance cards ready, to have a couple of people in mind that can, be their emergency contacts.
medications? Has medications department?
Yes.
So
A list
great.
of medications are important for the nurse to know what meds they're on and what they're allergic to and stuff.
Great. So after this, you send them on to the triage nurse, and that triage nurse collects additional data. Is that correct?
Yes.
Great. So can you tell me a little bit about the data that you collect? Do you use that? How do they use that here at Grand Itasca?
The important information is the insurance information,
Okay.
so that we can be sure to bill out that visit properly so that they don't have a mess on the other end.
Okay.
And that's important for the business office people.
Great.
So if we get the proper name of the company, the group number, the facility, or the company that they work for that they have that insurance through, and then just all their contact information for that company.
Great. So great. Well, thank you for telling us what your role is, Michelle. We're going to go talk to Rachel Busse, our triage nurse.
Thank you.
This area is the triage room, and Rachel is our triage nurse today. There are other nurses that also act in this role. Rachel will also at many times be caring for patients at Grand Itasca's emergency department. If you come to the triage area, she does an assessment of you, and she's going to talk about how she does that assessment. If you are coming in by emergency transport, our emergency transport personnel are providing assessments along the way, and they are informing our emergency department of your status. Welcome, Rachel.
Thanks.
So, Rachel's our triage nurse, and Rachel, maybe we can talk a little bit about what your role is at Grand Itasca as a triage nurse.
In triage, we do a quick assessment if we can to try to narrow down what your symptoms are, what your chief complaint is, and kind of try to sort patients as best we can according to their what we call acuity, which basically means the severity of your symptoms and how quickly you need to be seen by a physician. Other things we might do in triage, if you come in with a wound, we might quick put a dressing on that until we can get you back into an emergency room where the physician can see you, and if you need stitches, they'll do that back there. We might check your weight, we'll check your vital signs, we might go through your history a little bit, find out what medications you're on, your allergies, and any other pertinent information that we might find useful for why you're here today.
So all the data that you collect, Rachel, is then entered into the electronic health record, I assume.
Yes.
And how is that data then used by the other personnel that might be seeing the patient?
All the data that we enter is entered into the electronic record, and once it's in there, we all are seeing the same chart. So once I put in allergies and your medications and your vital signs and that type of thing, the physician's able to see it. Other people that you might come in contact with back in the emergency department will also be able to see it. So other nurses, lab technicians, radiology technicians, they'll all be able to see that same information so that we're all on the same page as far as what your care is circled around.
Does every patient go through triage at the time they come in?
Yes, every patient goes through triage. If you walk into the emergency department, you'll be filtered into the triage room where we, like I said, we'll sort through patients' symptoms and the severity of your symptoms. If you come in by ambulance, you'll also go through the same triage process, but that will take place likely back in one of the emergency department rooms, because you'll likely go right from the ambulance into an emergency department room.
Great. You also play a role in patient care. Once you leave the triage room, you work as a nurse in the emergency department. So as that nurse, what are some of the things that you do in that role?
As a nurse back in the emergency department, our first job is to do a further, much more in-depth assessment of your symptoms, something much more than what was done in triage. So we'll be assessing your heart, your lungs, if that's pertinent to why you're here today, and any other type of information that wasn't quite covered in triage. We'll kind of get a bigger picture of you and your healthcare history. We give medications back there. We will be starting IVs. We do some wound care. We assist with all sorts of procedures that the physicians might be doing at the bedside, as well as providing warm blankets and anything to kind of make you comfortable while you're back in the emergency department.
Great. What are some of the other personnel that might be working with a patient in the emergency department?
while you're back here, you might come across, or you'll likely come across a physician at some point, and then you'll also likely come in contact with perhaps lab technicians, radiology technicians, maybe respiratory therapy, physical therapy if that's something that you are needing while you're here, as well as our health unit coordinators and nursing assistants. And there are also usually several nurses back here, so you might be seeing more than one nurse at a time.
Great. Rachel mentioned that the next person, or the person that you will probably see as part of the visit, is our emergency room physician. Our emergency room physician today is Dr. Paul Palececk, and we're going to go visit with Dr. Palececk now. Thank you, Rachel. Well, we're now in one of our trauma bays here in the emergency department, and we have with us Dr. Paul Palececk, emergency department physician, and nurse Molly Lenoch, who's an RN in the emergency department. Welcome to both of you.
Hello.
Thank you.
So, first of all, let's talk to Dr. Palececk, and I am just a little bit curious about what the hours of operation are in the ER.
Well, the emergency department never closes. It's open 24 hours a day, 7 days a week, holidays, anytime.
So you're here all the time, in other words. So great. That's good to know. How many emergency room physicians do we actually have at Grand Itasca?
We have 7 full-time emergency room physicians.
Okay.
And then we also have other staff from the clinic who fill in on just a need basis.
Need basis.
Yep.
So you have like I think an OB person on call, a surgeon on call, some of those types of people as well.
Yeah, we do have other physicians available to help with emergencies as well.
Great. Molly, as a nurse here at the facility, how long have you actually worked in the emergency department?
I have been employed here at Grand Itasca in intensive care and ER for about 8 years, so kind of working in both areas. Mm-hmm.
Great. So, do you enjoy the role that you play as an emergency department nurse? So.
I definitely do, and my hours used to be more ICU, and I've recently switched to more ER shifts because of what I like to do in helping the public in emergency situations.
Great. Well, thank you. Can you tell me, Dr. Palececk, a little bit about what your role is as an emergency room physician?
Sure. Well, emergency room physicians are experts in acute care medicine, so that first 10 or 15 minutes often of a presentation, getting a patient stabilized, getting patient's pain under control, getting initial working diagnoses established so that we can initiate the appropriate diagnostic tests, labs, and radiology. Our role isn't often so much to come up with a definitive diagnosis. Often that is done either in outpatient follow-up or after you're admitted to the hospital.
Great. So, can you tell me what kinds of patients are the normal patients you would see in our emergency department? Or isn't that a good question?
Oh, it's a huge variety,
Okay.
and that's part of the appeal of emergency
Okay.
medicine. It's also one of the struggles we have. There's just an enormous variety. There's really no patient that can't be seen here.
Okay.
And so it is a challenge, but it's also something that interests emergency room providers and emergency room nurses. We have anything from fairly simple conditions that could probably be treated in other venues like the rapid clinic or the clinic, all the way up to severe injuries, motor vehicle accidents, heart attacks, strokes. We care for
Sure.
a full spectrum of disease and acuity.
People often complain, I think, about the long waits in emergency room departments. Can you explain why that happens?
Sure, I can give you my perspective on that.
Okay.
I've heard the national average is about a 4-hour wait.
That's what I've heard,
Usually
too.
Grand Itasca we usually beat that. We're usually about 1 or 2 hour wait most of the time. Sometimes we go past that average, but in the emergency department we can't we can't function on a by appointment basis,
Sure.
or it's not even safe. We have to, as patients arrive, they get assigned an acuity level, a triage number, and we really see patients the highest acuity first. And so if someone comes to the emergency department with a relatively low acuity problem, and there are a lot of higher acuity patients ahead of them, they may end up waiting a long time. And obviously high acuity patients can be labor intensive and take a long time to take care of them, and that can be, it can be sometimes a 4, 5, 6 hour wait in an emergency department, and that's with people working very hard, not eating lunches, not not commiserating. It's everybody's working really hard to get everybody seen, but sometimes it just ends up being a long wait.
So with that in mind, are there appropriate reasons or conditions or situations that you should come to the ER, and in other cases wait to go to the clinic or go to the rapid clinic? Are there those?
Yeah, I mean, we always tell patients that we're happy to see them in this setting. We don't really want patients to be trying to self-triage too much, but at the same time, if it's a minor illness, or if it's an illness that's been going on for quite some time, that is really not the role of the emergency department. The emergency department is to treat things that are high acuity, and acuity means a short time frame, serious. If it's been going on for a long time, maybe it'd be better something to be seen in clinic with your physician, or you could consult the rapid clinic, and they have actually a menu of services that are appropriate to be seen there, and if it's on that list, maybe that would be a better venue.
Great. What are your busiest times in the ER? Is it after the clinic closes, weekends, holidays? What are some of those really busy times?
That's a good question, and I think the answers surprise people sometimes. Holidays, weekend holidays are often the busiest times.
Okay.
The clinic's not open. There's often a lot of people in town who don't live here, so we're treating local folks, and we're also treating tourists and visitors, and so holidays, 4th of July, Christmas, Easter, all of those holidays are can be very busy in the emergency department. On any given day, usually our busiest time is between about 2 o'clock in the afternoon and 11 at night.
Okay.
And we try to double staff that whole time with 2 emergency department physicians for that period of time.
Great. And you all, as the emergency room physicians, you said are full-time. That means you're employees at Grand Itasca, right?
Correct. Correct. There are 7 full-time ER physicians who are employees of Grand Itasca.
Great. So that's really great to know. If you had one insight to share with the public about coming to the ER, what would that be?
Well, I'll just kind of touch on what I mentioned with the long waits. Keep an open mind. Be as patient as you possibly can be. We're very, very sensitive to the acuity of a patient's complaint and visits, and we're very sensitive to when they're in pain. And even though it may feel like you're waiting longer than you think it should be for your particular condition, it's probably happening for a reason, and we just have to do the best we can at balancing the patient flow. And so the more patient you can be in the emergency department, the better it will go for everybody.
As the patient is discharged, do you then provide them with, recommendations on follow-up care and when to go see their primary care physician, or if they're from out of town, do you send things with them to actually be able to have that follow-up care somewhere else?
Yeah, we provide, and Molly may be able to comment on that better, but we provide everyone with a packet of discharge information, and then the physician kind of determines need for follow-up. If we recommend stitches out in 10 to 14 days, we'll put that on the discharge documentation. If we recommend follow-up with your primary care provider or a specific specialist, we'll also put that in the paperwork. Sometimes patients will actually leave with with an appointment, although that can't be done all the time.
Sure.
Because the scheduling center has to be open for us to do
Okay.
that for a patient. But we try to provide as much information as possible when they leave.
Great. Molly, he said that you sent home a packet with them. What's in that packet besides the discharge information? Anything?
It's kind of a general summary of what happened here in the ER. So the diagnosis, what the physician is thinking he came in with, like dehydration or something along that lines, and then the labs that we did, the x-rays, any procedures that we've done for the patient, medications that we've given, and further discharge follow-up. So, and the nurse reviews all of that with you upon discharge, and that's a great time if you have questions or you're unsure, is to definitely ask about that. And if the nurse doesn't know, we can always ask the doctor, because we want you to be as clear understanding with the discharge follow-up as possible.
So great. Great. Well, thank you both for being our guests on Health Views this month. I would like to take the time to commend you for all the hard work you do at Grandi Task. I know some of the days are pretty hectic. And thank you for watching this segment of Health Views.